just quickly introduce our speaker and our trainer today. I like to call her our lecturer for the day, right? So we'll be having Cornelia Nicolaou, who is the program leader and lecturer at Unicaf. She's a lecturer of the School of Management at the University of Nicosia, as well as a research associate at the Medical School of University of Nicosia as well. She's also a visiting lecturer at the Cyprus Police Academy, and she holds an MSc in Global Marketing Strategy, a postgraduate diploma in international marketing, as well as a postgraduate certificate in business administration, a BA in business administration from the UK. And she has also received a diploma in circular economy, high mastery from the business school in France. And she has considerably academic experience teaching in higher education institutions since 1995, and she has been working for Intercollege and later for Unicaf since 1999. I mean, please, she deserves a round of applause at this point. Yeah, so during her academic career, she has taught various management, entrepreneurship, and marketing courses, and she has attended various seminars, webinars, conferences, which relate directly to her academic career as well as interest, and she has been involved in various projects. She has also published some of her research work and articles and journal, as well as her other duties and responsibilities as lecturers at the university. And not leaving out that she is also a supervisor for final year projects, acting as a special personal advisor to various students, as well as extracurricular activities. And she was also the initiator and organizer of the Global Conference in Entrepreneurial Education, organized yearly by the Management Department, University of Nicosia, with the collaboration of Junior Achievement Cyprus. I mean, a round of applause for our amazing lecturer for the day and our trainer, Cornelia Nicolaou. Thank you so much for joining us today and for taking our time to train us today. Please, let's drop some smileys a round of applause for her. Thank you.
I thank you very much. Thank you so much. It's a pleasure being here with you today, really, and I wish you could all be in one room so we could see each other and we could have an interaction. Let me share my screen so you can let me know if it's okay. It might take a few seconds to... Is it okay?
Yes, it's perfect. Perfect.
Thank you very much, dearest. So, hello, everybody, and welcome. It's really an honor to gather today with professionals who not only save lives, because let's admit it, doctors save lives, and it's a good day today to save lives. So you save lives, but also at the same time, you shape the future of healthcare through leadership. It's a field where decisions often carry profound consequences. It's not an easy field to belong into. It's a strong field. You definitely need compassionate leadership, and what you give and what you offer is more than valuable and very essential. So today we will explore what it means to lead in medicine, because so far we have learned that we lead in management, we lead in various organizations, but what about the medical sector? We lead in the medical sector as well, with vision, with resilience, and with integrity. So the aim for today's training session is to educate, to inspire, and to empower the doctors and nurses in Africa. We need them to lead with vision, resilience, and impact on the practical, on the context, using relevant leadership and management principles, because needless to mention that during the daily operations of a hospital or even a simple practice, you don't need to run a huge hospital. Even if it's your own practice, you are still a leader. So all these management principles are applied daily on your working environment. Patients must be able to trust doctors. Everything starts from trust. The patients give you in your hands their lives and health. So you need to justify this trust, and you must show respect for the human life and make sure that your practice is going to meet the standards that are expected. And this is something that the national health system of the UK has developed. So all doctors have responsibilities, all kinds of responsibilities, using resources, for example. So you may be leading a team, or you might be involved in supervising your colleagues. So what are these primary duties of all doctors? First of all, you start with the safety of your patients. That comes first. Then we have everything else. So whatever the role of the doctors or the nurses or anyone who is involved in the medical profession, you must do the following. First of all, you need to engage with your colleagues, whoever these colleagues are, to maintain and improve this safety and quality of patient care. So little details count. And I will give you an example. The American Heart Institute in Cyprus, which is a private hospital, now it is renamed into American Medical Center. I had to be hospitalized there a few years ago, and I was listening to the cleaners. And the cleaners, I was in my room having my breakfast, and the cleaners came to clean and fix the sheets and everything. And I was listening to the cleaners saying, adjust the table, adjust the bed which was next to me. It's a little bit far behind the line. And I was like, what are they talking about? It got my attention. What do they mean? It's a little bit behind the line. I didn't ask them, but I was observing what they did. As the tiles on the floor, the manager, who was a doctor as well, wanted the beds to be aligned on a specific line, which they were marking the tiles there, and to have a precise distance from one bed to the other. At that point, I was like, it's a very little detail. But on the other hand, every little detail counts. Just picture entering into a room, whether you are a patient, whether you are a doctor, whether you are anyone, and you see beds not aligned. One is looking towards one direction, the other one is looking towards another direction. It's like somebody just dumped the bed into the room. So you probably start wondering, what's happening in here? Our vision is used to seeing things in neat, with certain directions displayed in certain ways. So immediately, subconsciously, a bed that is not aligned in the right position might create some negative feeling, which consciously you don't realize. Subconsciously, you realize. Okay, so every little detail counts. You need to contribute to decisions, to discussions about improving this quality of service and the outcome. You need to demonstrate effective teamwork and leadership. Nobody works alone. Teamwork. Even if you are not part of a surgical team, you still need to cooperate and collaborate with other doctors, with other nurses, even with the cleaners, with the managers, with the administrative task. Everything is all about good teamwork. You need to promote a working environment free from discrimination, free from bullying, free from harassment, keeping in mind always that your colleagues and your patients come from diverse backgrounds, men, women, different ages, different culture, different nationality, different perspectives, understanding. Nobody's the same. You need to contribute into teaching and training doctors and other healthcare professionals, including by acting as a positive role model. They are going to imitate your behavior, your actions. So if you are the leader, if you are their boss, they will imitate what you're doing. And you need to use the resources efficiently for the benefit of the patients and the company and the public. So why leadership matters in healthcare? For these 5 reasons that you can see here. First of all, leadership influences patient safety and outcomes. So we have effective clinical leadership, which is directly linked to reducing errors and improve care quality. It helps team coordination. So the leaders foster interdisciplinary collaboration between different departments, for example, which is essential in high pressure medical environments. and the medical environment, it is a high pressure environment. It helps change management. Strong leadership is going to enable successful adaptation to all the changes. The external environment is very dynamic. Just remember COVID time. During that time, huge adaptation had to take place immediately. I mean, within minutes, within seconds, you had to adapt to the new environment. So you adapt to new policies, you adapt to new technology, you adapt to new procedures. Who is going to help you do that? A good leader. It helps to with staff engagement and retention. Supportive leaders will improve the morale. If the morale is improved, it's going to help reduce the burnout. And if the burnout is reduced, we're going to have an increase in job satisfaction. And if we have an increase in job satisfaction, we will have a decrease in employees leaving the hospital. The turnaround of employees will be reduced. And of course, don't forget ethics. Last but not least, ethical guidance. Medical leaders uphold ethical standards. So you need to ensure accountability and professionalism at all levels. So why is leadership for the medical profession matters now? We have identified the importance of it, but why now? Why we talk about leadership in medicine today? The African health system is facing unique challenges. We have underfunding, we have limited staff, we have supply shortages, we have increasing public health demands. So leadership and management are not optional, it's a must. They are the difference between survival and burnaround. They are the difference between leading successfully, opening hospitals and public hospitals and private hospitals, which are sustainable for a long period of time, and they offer high quality services to patients. Without leadership, your staff morale is going to decrease, the patient care will start suffering, conflict will increase. You see, when there are problems, conflict increases. When there are disagreements, when there are issues that needs to be resolved, when there are changes in the external environment and there are more issues to be resolved, then conflicts will increase and the progress will stop. You know, a weird thing, somebody was telling me, and I searched about it, that during COVID time and a little bit after COVID time, divorces increased. And they were like, what happened? And divorces increased. What was happening during COVID time? It's not so difficult to analyze because during COVID time, people had to stay home. We had the lockdowns. So you probably had to spend more time with your spouse that you have ever spent in the entire time that you were with the other person. So you started developing different ideas. You started knowing and actually learning your spouse. And when there are differences and they were coming up to the surface without actually identifying well and discussing those differences in the appropriate manner, conflict started to increase. And when conflict started to increase, in the case of husband and wife, we had, bye-bye, nice meeting you, thank you for the good time we had. And then that's it. For the employees in a hospital, it's even worse because there is something that's very important for patients. They stick to their doctor. They want their doctor. They love their doctor. They are connected with their doctor. They don't want to change their doctor. So without leadership, all those four things are going to happen and the doctors are going to go. They will leave, and that's not what you want because you might lose patients. Leadership is not about being in charge. It is about taking care of those in your charge. There are some people that they depend on you. So leadership is taking care of those people. Leadership is about having a vision. If you don't know where you're going, how are you going to get there? So leaders have a vision, and there is a big difference between a boss and a leader. The boss is going to say, do it. The leader is going to say, let's do it all together. So the boss is going to know how it is done, but the leader is going to show you how it is done. So good leaders will train well their interns. and you're going to have good doctors. The outcome of this good leadership is going to have good doctors. So leaders are people who can influence the behavior of others without having to rely on force. If you're scared of me and you listen to me because you're scared of me, it is a type of leadership, but not the appropriate type of leadership. So people who are accepted as leaders by others are the people who can lead. And I give some, just not to get too far away from the academic notion, I give you two definitions of leadership. So what is the meaning of leadership? Why leaders lead and what do they actually do? So first of all, leaders, they need to use this non-coercive power. They shouldn't be scared of us to influence and shape the group and the behavior of people belonging in the group or the organization's goals. There are certain goals. Behind every hospital, there is ownership. This ownership can be the government, or it can be one single doctor, or it can be a group of doctors. This group of owners will set the culture, the goals, the aims, the objectives of their business. So your job as a leader, even if you are one of the owners, is to fulfill the organizational goals. So you need to have some management training, because leading is also managing and motivating others towards fulfilling the organizational goals. It means that you need to have a little bit of management training. There are a lot of issues that we can refer to today, but I have tried to stick to some very basic ones and to just scratch the surface of practically every little area that I could. It's impossible to do everything in 1 hour, but I'm going to try to give you kind of a holistic perspective in terms of leadership and management of what is expected by you. So it's your job to help define the organizational culture. Why leaders matter to their team members? Because you will give them the direction and the vision. You are going to help them into keeping the groups orderly, and you are going to be the ones who will affect the group performance. Why? Very simple answer. The group will depend on you. You are leading, and the people who lead depend on us. They tend to imitate what we do. They tend to take the examples that we do. So if we lead by example, if we lead by objectives, if we give them the correct guidelines, they will follow. All they need is somebody to lead them. Leaders are needed. So what is clinical leadership? The concept of clinical healthcare staff undertaking roles of leadership. Like what? Setting, inspiring, promoting values and vision, using your clinical experience and your skills, because don't forget, above all, you are a doctor. We need this clinical experience, and we need the skills to ensure that the needs of the patient are the central focus of the organization. So while we lead, while we satisfy the objectives and the goals of the business, we always keep at the front of our head that above all, we are doctors and patients comes first. So clinical leadership is the key to both promoting high quality clinical care, and at the same time, you're transforming your services to achieve higher levels of excellence. There is a lot of competition. In Cyprus, before the national healthcare system, there was huge competition among the private-owned clinic. There was one hospital which was owned by the government in every major city. So it had 5 hospitals in total, owned by the government. Not very well organized, not very well run, very bad healthcare. Believe it or not, yes, they were not providing good healthcare. Only the hospital of Nicosia had specialized doctors who were the best in their area. And they were, if it was a private business, it was going, if it was considered, let's say, to be private business, it was going down the drain, the service that they were offering. As opposed to the private sector, where we had a number of privately owned clinics. If I tell you how much they were charging, you probably think, what's happening in here? I knew somebody who had hospitalized his mother in one of those clinics for 1 month. She had a brain tumor. She had an operation. She had the tumor removed. She stayed a few weeks in the intensive care unit. 2 months. And the rest, it was in that hospital. They paid 95,000 euros from one patient. And like her, hundreds of patients. So we were talking about a business that was a cash cow. It was generating lots of cash. They were charging a lot of money. They were getting a lot of money. They were able to reinvest money. Who is going to take the decisions? Leaders, managers, leaders. The doctors were part of this team because they were the owners as well. And like this clinic, we had a number of clinics. So when we had the national healthcare system, they all joined this healthcare system. And now instead of the patients paying, the government is paying for all this money. So to have clinical leadership, you need clinical leaders. Who are these people? Effective clinical leaders require having an understanding of the whole system of care. You cannot lead if you cannot understand the system. And that means if you are changing from one country to the other, you need to understand the healthcare system of the country or of the city or of the place where you are currently working at. You start from that. And that's the only way to start leading effectively. Understand, first of all, the environment where you are. So it's very vital for all the continuous improvement, for the quality and the safety of the care, and for assuring the timely introduction of any new interventions, anything that needs to change. So good clinical leaders unite clinicians and managers. You are the link. I don't know if you're watching Netflix. There is this series. It's called New Amsterdam. And is about a doctor who is at the same time the manager of the hospital. And you see the struggle of this person trying at the same time not to reduce the quality of the service and also make profits for the shareholders. It's amazing. It's amazing because a doctor is struggling between two worlds. The world of providing to patients the maximum healthcare quality that I can, and at the same time, fulfilling the organizational objectives, goals, and aims, so the shareholders are happy. You are the liaison. You are the link between these two worlds. So you are the key to the development of a healthy organizational structure, which is going to fit to deliver effective, safe, and patient-centered care. So what is the clinical leadership competency framework? This is based on something that the NHS developed. Okay, so hang on a minute because something changed on my screen. So the clinical leadership competency framework was developed by NHS. So let's see what the English people have thought of developing, because you see, in the previous time, and I'm going to say this without any hesitation, the English healthcare system was one of the best systems in the world. Unfortunately, in the near past, that's not the case. There are certain hospitals, certain private clinics which are very good, but there are a lot of problems at the same time. And the recent development, because I know this from my research, the recent development that is happening is for NHS trying to develop a number of models which will be embedded in the degrees of universities. And my PhD, my doctorate, is based on that, to develop undergraduate courses and modules which relate to leadership and management, which will be embedded in the curriculum of doctors. Because you are asked to manage, you are asked to lead in your careers, and you need this knowledge. Because everything now is so competitive, so competitive. Even one clinic is competing with the other, even in the same hospital. You have different words competing with another. It's amazing. We are living in a world that everyone is competing with everybody else. It's a kind of a nightmare. It's scary. So the only way that we can deal with all these things, with all these changes, is if we are trained, if we receive the proper knowledge. So what NHS has developed is these pillars. Demonstrate personal qualities. We start from us. So start with self-awareness. What is this self-awareness? It involves understanding your strengths, your limitations, your emotions, your values, how your behavior is going to affect others. Self-awareness is crucial for improving interactions with colleagues and patients. Start by knowing you. Who are you? What are your characteristics? What is your personality? Like, for example, if you have a doctor working in a rural clinic in Uganda, for example, I'm going to use random countries, okay? Random countries, not necessarily they are accurate. It might reflect on how the stress affects their tone when communicating with the staff. When you are working at a clinic that is understaffed, you feel all this pressure. That is going to change the tone of your voice, the tone of having a conversation. So you need to recognize that there is a tendency to be abrupt under pressure, and you need to make a conscious effort to speak calmly during busy clinic days, because the busy clinic days is something that it might change your personality, yourself, it might change your characteristics. So during difficult time, the self-awareness becomes more important. Managing yourself means handling your own time. Handle your emotions. Understanding your emotions is one thing. Handling your emotions is something else. I'm angry. I'm upset. I understand that. But how am I going to deal with being upset? Or I know that A, B, or C, or D are my emotions. Okay, I realize. How am I going to handle them? That's the big question. So handle your emotions, your responsibilities effectively. It includes maintaining all this personal well-being and resilience of the challenges that you're going to face. Never surrender, never give up. You cannot surrender. You are allowed to fall. You are obliged to stand up. Everybody is allowed to fall. We all have difficulties in life. We are all going to fall, and in our personal lives and in our professional lives. But we are obliged to stand, either in personal or in professional life. Ensure your continuous personal development. Believe it or not, I met a doctor who for 20 years, he never attended a single conference. A single conference. He was not aware of what was happening in the other world. He was a gynecologist. So he was delivering babies, doing pap tests, doing the checkups, and that's it. You need to progress. You need to see what's happening in the other world. So the personal development, it's very important. This involves taking responsibility for learning, for growth, seeking feedback, staying updated with medical knowledge, with leadership practices. If, for example, you have a physician in Kenya, let's take another country, and he attends monthly webinars, seminars, conferences, all this knowledge will be transferred to the other members of his team. Everything that he or she is learning will be transferred in the working environment. So what you learn, you will teach. Personal learning is important because you will become the teacher for somebody else. Acting with integrity, ethics. Acting with integrity means being honest, consistent, ethical in your behavior and in your decisions. It's about doing the right thing, even when it's difficult. I know it's difficult to keep ethical standards because of the nature of countries, of the nature of nations, and I don't mean about the African nations, even in my country, even in Europe, they do that, even in a lot of countries, in Greece. You know how many times you have heard doctors giving priorities to other patients by taking some money under the counter, let's say. I'm not going to discuss whether it's right or wrong, whether it's ethical or not. There is no right or wrong. It's what I can accept and what I cannot accept, what I can do and what I cannot do. We are not going to discuss this. But as leaders, you need to act with integrity. You need to be persistent and consistent in whatever you're doing, however you are practicing your work. And then we go to something else. We leave ourselves and we go to another section, working with others. We don't work alone. You need to work with others. This means building connections with colleagues, professionals, organizations. You share knowledge, resources, support. Good networking is going to give you good service delivery and innovation. Bring new things. For example, you might partner with somebody in another country who is offering something that you are not aware of, or something that they are willing to share with you. I'll give you an example, a real life example. There was this doctor, a friend of mine, in a clinic here. It was a private clinic. And that clinic was the first clinic which introduced the Da Vinci robot for operations. She was the only doctor, she and somebody else, 2 doctors, who were willing to learn and to train, and they were fighting to keep the robot in the clinic. It cost 7 million euros, that robot, 7 million euros. The other doctors wanted to return it back. And when I had conversations, the reason was they didn't want to learn. They didn't want to learn how to use the Da Vinci robot. They were happy with laparoscopic surgery. They were happy with the traditional way of doing operations. They didn't want to learn. And they were giving fights, the 2 of them, to keep the robot. After 15 years, every clinic now owns a Da Vinci robot. So you need to keep up with what's happening. Collaborate and cooperate with others. Develop networks, build relationships that other people can help you. Build and maintain these relationships, because building relationships is one thing, maintaining the relationships is difficult. Encourage the contribution, create an environment where everybody feels safe and motivated to contribute. Ideas, feedback, concerns. This is going to lead to better decision making and engagement of people. If people are involved in a decision making, they're not going to deny later on, I'm not doing it, I didn't know about it, you didn't tell me. What do you mean I didn't tell you? You were part of that relationship. You were part of that contribution, of that decision. Also, working with teams, effective leaders collaborate and cooperate and communicate clearly with the other team members. You're not alone. You recognize the different roles and you need to build cohesion within the team members. Managing services. Now it's time to manage what you are offering. Start with planning. Effective planning ensures that the services meet the patient needs. They're safe, they make the best use of all the resources available, and it involves setting your priorities. Plan, and we will say a few things about planning later on. Manage the resources. You are given certain group of resources, whatever these resources are. It can be material, it can be human resources, it can be money, it can be anything. So managing the resources means that making sure all the equipment, the medicine, the staff, the time, they are used effectively, efficiently, and responsibly. It also involves reducing the waste, and you working within your budget constraints. I know that it's difficult for the medical profession to reduce the wastes. You're not going to use, let's say, an injection to 5 patients before you throw it away. You can't. So it's inevitable that some of the wastes will increase, but it's up to you to manage effectively overall the wastes and what you can do with the resources that you have. You need to manage people, supervise people, support people, motivate the healthcare workers. Good people management involves increasing their morale, building their morale, increase their productivity. And if you build their morale and increase the productivity, the patient outcome will be improved as well. They will be happy about it. They will be happy for the quality of the service that they receive. And don't forget that you need to manage performance. So managing performance, you monitor and evaluate the service delivery of the people who deliver the service, of the actual service that you deliver, okay? and you identify what's working, what's not working, and you look for the areas that can be improved. There are always areas that can be improved. So in order for you to be able to manage the performance, you need to set standards. And you start by that. I said standards. Standards of behavior, standards of performance, standards of how I want things to be done. Then you will be able to compare the outcome with the standards. And you take corrective actions in case something went wrong. So you need to improve the services, as we said, because what you are offering is a service. Start by ensuring the patient's safety. Minimize the risks. How do we minimize the risks? We follow protocols. We promote culture where the errors are reported. If you promote a culture that people are afraid of speaking to you, they will be afraid to report the mistakes. And the mistakes will be hidden under the carpet. And mistakes that they are hidden under the carpet will be forgot about. And it means they will never be solved. We don't want to have unsolved mistakes because unsolved mistakes might repeat themselves. So encourage patient safety by encouraging a climate that you have very good communication with your subordinates. You solve the problems. Critically evaluate. Assessing clinical outcome systems, practices, using evidence and data to identify what works and what doesn't work. We are going to do this because we have tried it, we have tested it, and it's working. You know that it's working. There is a fact, you have seen it. That doesn't mean that you're not going to try a few things. Yes, you are. But the things that they're not working, you're not going to repeat. The things that are working, you will repeat. And you encourage the improvement and innovation, which has to be there. You promote the new ideas. You support experimentation. You motivate your staff to seek better ways to deliver care, even within the limited resources that they have. If I have 3 ingredients to make a cake, I'm going to see how best I can use these 3 ingredients to make a cake. I will bake a cake. It will be good, and I will enjoy eating that cake. So make use of the resources that you have. I know it's very difficult. It's very difficult for this profession. But fortunately or unfortunately, this is what we have. And you need to utilize the maximum of what you have. Make the most out of it. Then, encourage improvement and innovation. Oh yeah, that we have said. Facilitate transformation. What is that? You support the changes. If you're a person who doesn't like to change, who doesn't like changes in services, in culture, in the medical service given to students, then you're going to have a little bit of struggling adapting to the new environmental changes. And I will give you another real life example that was happening in many cities in Cyprus. When women were having a baby, and I don't know the appropriate term, the medical term, so please excuse my English because I don't know the medical term for that. When the women were having the baby, they do kind of this injection for the pain, so you can be in labor without actually feeling the pain. I don't know the medical term. So that started with the anesthesiologists who were located in Nicosia. They were receiving training, and it was a kind of a must for the clinics, for the private clinics in Nicosia, because women could enjoy giving birth without feeling the pain. In the other cities, and especially in Larnaca and Paphos and in Famagusta area, the doctors, the gynecologists were not very keen into bringing this method, and it took many years to accept this method into their clinics. The reason they were saying is that it's not safe for women. Even though there were statistics, there were seminars, there was research that it was proving that it was safe for women, they were refusing to do it. the real research has shown that the doctors did not want to take the risk. They did not want to have extraditional risk of, for example, giving a C-section while the patient is awake, not feeling the pain, awake, but not feeling the pain. So everything started from what I said before. Understand who you are so you can improve yourself, build self-confidence so you can accept the changes. Because they were not feeling self-confident into what they were doing, they were refusing. They were not facilitating the transformation. Okay, so one way to facilitate transformation is, first of all, to accept transformation ourselves. We need to accept, and then we can change. Once we know what we are doing, oh, there's one more, I think, sorry, evaluating impact. Yeah. Improving, I moved fast, improving services, yes. Setting direction, yes, we are here. So once you know what you're doing and you accept it yourself, then it's going to be so much easier to persuade other people into that. Then you set the direction. You are the leader. We said the leader never says go. They say, let's go. You are all together. So you start with identifying the context for change. Why do I need to change? What is the broader environment? What's happening? What are the changes in the social, political, economical, organizational environment? What are the influences in the healthcare system? How is the healthcare system changing? So you start by identifying, why do I need to change? What is the change? And then you're going to apply the knowledge and the evidence. So using all this clinical guidance that you have, the local health data that you're going to get, you will give informed decisions and develop strategies with your team. You are going to start this change. You are going to apply this knowledge and you are going to give them evidence. So you are going to have to make decisions. Decisions are based on you. How? Sometimes it's easy to take a decision. You know what is difficult? To persuade other people to listen to us. We can all take decisions. But how can I persuade others to listen to me? You need reasoning, logical discussions. You need reasoning, you need experience, and you need evidence. So if you prove to people, if you are giving them logical reasonings, and if you have the experience, because sometimes the younger generation tends to listen more to the older generation because of the experienced doctors, let's say, can influence the behavior of others easier and faster. So if you can do that, you will balance the risks and you are going to make the best use of all the available resources. Don't forget to evaluate the impact. So assess whether the decisions and changes have achieved the intended outcome. So whether you have used the information for the better, not for the worse, for the better of improving the service. So to sum up what we have here, the 5 pillars of effective medical leadership. You want to be an effective medical leader, you need purpose, which is what is going to keep you grounded. Purpose is what keeps us grounded. In healthcare, it's very easy to get lost in the routine. But when we remind ourselves and our teams that every patient we serve is someone's parent, child, or friend, then it's going to reignite the compassion. People have names. They're somebody's mother, they're somebody's child. So let's give purpose to this leadership. So leadership starts by helping your team see meaning in their work, even on the hard days. So for example, even if it's a day where you're struggling and you're wondering, what can I do? I need to save a lot of people and I cannot do that. Have a purpose, plan, disseminate information, bring people on your side, and you can succeed. You can be an effective leader. I always say to my students, to my trainees, If the others can do it, then you can do it. Nobody's better than the others. So always have this in mind. If the others can do it, then you can do it. You need people. Empower others. Leadership is not about doing everything yourself. It's about creating other leaders. So you empower your team. You're the leader, but you are growing little leaders in your team, which they can become big leaders in the future. And they are going to run their own teams. So they depend on you. Empower them. Delegate not only the tasks, but the responsibilities, and above all, trust them. They are not going to listen if they feel that you don't trust them. Make them feel that you trust them. Give them this trust. Praise publicly. You know how important it is for people to listen from their boss, from their leaders, from their managers, from their whoever. Congratulations, you did very well. Thank you, Dr. Cornelia. The operation went great. You did great. You saved the patient. It might not be important for some people to say it, but for the people who listens to this, it's extremely important. So praise people. Good leaders praise people. Bad leaders don't praise people. They want to take all the merit themselves. So remember that. Good leaders are not afraid to delegate the glory and to share the glory with other people, with their subordinates. So staff is more likely to raise, as I said before, to raise issues if they trust you. And they will trust you if you are a good leader. Planning, presence, it means be there. Be seen on the floor, not only in meetings. Don't appear only in meetings and it's like, oh, Dr. Cornelia came here today. Who is she? We've never seen her. No, you are part of a team. The team wants you to be there. Don't be there only when it's difficult time. Be there everyday time, whenever it's possible. Spend some time, even if it's 5 minutes. Check on them. Everything okay today? Anything that you need to mention? So it's all about, as I said before, building trust. So share how your presence helps, let's say, within your team. Don't forget about planning. Prepare for chaos. It's a very good word to describe a day at the hospital sometimes. But good planning will avoid chaos. So effective leaders expect the unexpected, whichever discipline you come from. So you can have power cuts, you can have running out of stock, running out of drug supply, sudden outbreaks. So these are not rare, but they might, as we see that the way the world is turning, this is something that it's happening more often. So plan means eliminating problems to the maximum. It doesn't mean we stop problems, but we are trying to eliminate problems to the maximum. And it doesn't take a very difficult system. Something simple when it comes to planning, it's easy. For example, a whiteboard. Just make a plan on the whiteboard. As you're doing it, I'm sure you're doing it. You write names, responsibilities, names of doctors, names of nurses, plan. Everybody should be aware of what they are doing, when they are doing it, and who they are responsible for and which are their responsibilities. And the last one, progress. You don't need a massive budget to improve, okay? You start small. Track patient wait times. Follow up the rates. The patient wait times, it's important. Do you know how much time can be saved by saving on the patient waiting time? The patient deserves to be treated well, so you're not going to cut from the time you spend with the patient, but you can cut from the time of the patient that is waiting, let's say, to be serviced by you. So it's kind of small things that it's a win-win situation if you start paying attention to. So we've reached a point where now you know that you need to be effective leaders and you need to manage. Not all leaders are managers, but all managers need to be a leader. A football player, an important football player, let's say Pelé, Ronaldo or David Beckham. You see from the names I'm using, it's not my area of interest, let's say the football. So these people are leaders. They are effective leaders. Do they need to be managers? No, not necessarily. They don't need to. But all managers need to be leaders. So if you are assigned a ward and you are the manager of the ward, the manager of a clinic, the manager of a hospital, then you need to be leader. So the managers are the people who whose influence on others is limited to the appointed managerial authority. A manager has certain authorities, certain tasks, certain issues to deal with. That's it. Their positions are going to provide reward, punishment, whatever, and that's it. But leaders are the people who, with managerial and personal power, are going to influence others to perform actions that cannot be dictated by managers. They cannot be dictated by a formal position just by having authority. The manager says do it, you might do it, but you might do the minimum possible and not everything that you are requested. But if your leader says, let's do it, and you are a team and is leading you and is inspiring you, then you're going to feel this stimuli of we are together. So you're not alone, you have a team, and you're both a manager and a leader. So the leaders are people with vision. They are going to implement change. They are thinking ahead. They are the people who are going to inspire others. They are going to handle the unknown. They are going to lead through crisis. They will encourage the growth and ownership. They are going to teach others. And the managers are the people who are going to take the decisions, follow the processes, give the orders, organize people and resources, track the progress, policies, compliance, ensure the goals are met. In healthcare, you are both. So you need to do what the leaders are doing, and you need to do what the managers are doing. So a head nurse, for example, must manage shift schedules, but also lead during emergencies. So the job is not just doing the managerial stuff that they are assigned because of my authority and because of my title. I have to lead during times and during events and occasions that they are not listed in my title and in my authority, but I need to do it because I am a leader. So the basics of management is to lead efficiently and effectively. Efficiently means you will use your resources wisely in a cost-effective way so nothing is wasted, and effectively is to take the right decisions and successfully implement them. There are a number of different leadership styles. What leadership style you will follow depends on you. It depends on your personality, it depends on who are you, it depends on the clinic that you are leading, it depends on the situation, and it depends on the occasion. So your style is going to describe how you lead. Your leadership style, it's you. So there are many different leadership styles, as I have said, and no one style is correct for all situations. So you might realize that depending on the situation that you are dealing with at the moment, you might need to change your style. Very, very quickly, just to say a few things so you will know the different styles, and then you choose the style that you want to follow. The autocratic is when you take all the decisions. The leader takes the decisions, no consultation. The leader is the center of the attraction. If anything goes wrong, the leader is going to take the blame, okay? You might not consult others. The employees do not like this system because they might feel suffocated. It's like you don't appreciate their opinion, you don't want their opinion. It can be, though, related task-oriented most of the times, and you don't worry so much about people. So let's say, I'm going to use an extreme example now. Let's say you are in an emergency situation, you are in the theater, you're having an operation, you're giving an operation, and there's an immediate decision that has to be taken. You are the leader of the team. You've got the other doctors saying, no, but we need to do this. No, bad. Is leading nowhere. So you are the leader. You have to be autocratic. You are going to take a decision immediately because the patient is at risk. So it's your risk, it's your gain, or it's your blame. That's the autocratic. The democratic is when you make decisions based on the input of each team member. So you're asking the other team members, you get their opinion, you worry more about giving greater satisfaction to the members. It works better for the leaders because it minimizes the risk of what you're doing. And it's something that the subordinates appreciate, democratic leadership, because they feel involved in the decisions. The bureaucratic leadership is when you follow the leadership style that is based on the commands, on the rules, on the regulations, on the specifications, on the specializations, the divisions of the work, the divisions of the labor. It's a little bit of impersonal. So, in other words, in English, we say you go by the book. Whatever the rules are, whatever the policies are, it's your right. The leader trusts neither himself nor your subordinate. So basically what you do, you just follow the rules and the regulations. We play it safe, in other words. So let's do what the policy does. And believe me, it's a very good way of finding fast solutions when nobody knows what should be done. And when there are a lot of risks involved, it's like, what should we do? Okay, what do the rules say? What do the policies say? Let's follow the policies. This is the bureaucratic leadership. And we have the laissez-faire leadership. It's a French phrase. Excuse my French, I'm sure the pronunciation was not French at all. So it's kind of, just leave it, let it be. It is what it is. So it's used to describe a leader who leaves his colleagues to get on with their work by giving as little guidance as possible. It's like, I trust you and I know that you're going to do a good job. So go ahead and do it. I'm done here. I finish off with the patient. I'm continuing in another room. I trust you that you're going to do a good job. So you don't give them the guidance because you have already given them the guidance. You know, you don't do it to subordinates who you don't know their qualifications or their qualities. It works for teams usually when the individuals are qualified, experienced, they have expertise, they are skilled, and especially if you train them and you know what they know. So excellent leaders are going to know how to use the correct leadership style for a given situation. As I said, feel free to choose what you want to do, depending on the situation. You will help the individuals recognize and maximum their full potential. You see, they say one person can bring out the best or the worst from you. So it can bring out your best character or the worst version of your character. Who is this person? It's you, the leader. So your job is to maximize the potential of your team members. There is potential, maximize it to the fullest. Use your doctors, the nurses. If the nurses are, let's say, the managers, use the other nurses in such a way so they work at full capacity, they maximize at their best all their skills, qualifications, time, and that is going to improve the quality of the service. And when you have improvements of quality of service, you have customer satisfaction, because allow me to call the patients customers in a very hard language, business-wise talking. Patients are customers, students are customers. At the end of the day, whoever gives us money is kind of customers. So patients are customers, and we want patient satisfaction. And you need to energize and engage people by helping them create a meaningful sense of purpose and direction of their work. Be careful though. Sitting on a throne can be dangerous. Love of the power. I'm in charge. Sometimes this I'm in charge can turn a person very arrogant, very selfish, egoistic. So being in charge means having power. Don't abuse the power. So if you abuse the power, you can become egoistic and selfish. If you don't listen to others, again, it's a problem. Fail to listen to others' experience. Just listen to what other people will say. Don't say I'm the best player in the field and I don't listen to anything else, because somebody might have something to tell you that you don't know. There was this joke that was going around with Maradona, the football player, and Pelé. I don't remember which of the two, but I think it was Maradona who said, God sent me to teach football on this planet. So the media were interviewing Pelé and they told him, do you know what Maradona said? Maradona said that God sent him to teach football in this planet. And everybody was kind of waiting. They were waiting for Pelé's reaction, response. And Pelé said, I don't recall sending anyone. So we had two extremely important world football players, and it was this kind of I'm better than you in a very funny and amusing way, let's say. But even sometimes in jokes, we can see the reality. Try too hard. That's a hazard of leadership. You're trying. It doesn't mean kill yourself and exhaust yourself. You have a certain capacity. Don't over-exceed your capacity. You're a human being. You will break. Get involved in too many things at one time. Try to do a number of things at the same time. I know it's difficult, but it's not impossible. Fail to organize. You want to be an effective leader? You have to be organized. Frustration from disappointment in others in the group. You will be upset by the way that other people are doing things or dealing with things. But this is the time, remember what I said before? Self-control. Frustration from disappointment will bring conflicts. Try not to show your frustration in an angry way. You will lose. You will lose. Tips for successful leadership. What can you do? Match the task to the capabilities of the person. If one doctor, if one nurse, if anybody is not able of doing a task, don't assign it to that person. Involve different people. Pick and mix. You have resources. Involve different people all the time. People love that. Don't dictate, delegate. If you say, do that, that's dictatorship. Try to delegate some of this authority and you monitor the progress throughout the completion. Consider alternative plans and people. A good leader has always an alternative plan. What if something goes wrong? What is my escape plan? Have an escape plan and have escape people. Evaluate the task. Is it difficult? Is it easy? If you know one task, if it's difficult, easy, accomplished, non-accomplished, you will be able to match the task to the capabilities of the person and express appreciation, as I said before. Thank you. One small word like thank you, congratulations, well done, I'm proud of you. This is heaven. It's music to the ears of your subordinates. How can we lead a medical team? Let's say a few practical things now. I don't know if I have more time. I think I need 10 more minutes. Am I okay, dear Hannah?
Oh, yes, please.
Okay, darling. So what are the daily hurdles, let's say, that you can do? 5-10 minutes when the shift starts. I know that the doctors do that. And they call it, it's kind of handling and delivery, receiving. There is like a term on that. Like the previous shift is going, but they are informing the new shift about the cases, the patients, etc. Okay, fine. You cover the goals, you give the updates, you give the key patients. But what about how are you? How was your day? How do you feel? Have a lovely rest. Enjoy the weekend. Something nice. Something that is not work-oriented. Something that is a little bit of personal to the team. Thank you for doing the work today. And try to rotate facilitation. Have different people in charge. That helps you to build confidence in the team. If it's always you, and you are always you, the leader, and somebody else, they will consider that person as the only person that you trust. That is not going to help build confidence among the team members. Okay? So, one day Cornelia is in charge. Next day, John is in charge. The other day, this person is in charge. And I'm not talking about the sisters that they have to be in charge, let's say, for a specific team, nursing team, let's say, because of their qualifications. I'm talking about some other duties. Rotate. Help. It's going to help you build confidence. So it's very bad if you say, you handle that, but it's good if you say, Nurse Joyce, Nurse Cornelia, please manage, triage, what gets attention first, let's say, and why from this time up to this time, with John, with Mary, with Hannah, let's say. Okay, so even if you need to have one person, like the sister all the time, have somebody else on a rotation helping the other person. Because people are going to feel they trust me as well. And I'm not saying, because it's a very sensitive profession, and I'm not saying give responsibilities to people that you don't trust. No, safety of patients above all. If one person is not suitable for a task, you're not going to give them that task. But if you build training and leadership within your team members, then you will be able to choose who matches with whom. Improve listening skills. What a nightmare. Human communication is one of the most difficult areas of the human nature. Really, sometimes I'm wondering, how come animals communicate so well and human beings cannot communicate? We speak the same language and we cannot communicate. We have so many misunderstandings, so many conflicts. It's like people are talking A, they understand B, they do C. A good leader should improve listening skills. Be careful. Listening skills, not hearing skills. Sometimes I say to my students in class, how many are listening? I see their hands up. I say, no, not listening. Hearing. You are all listening my voice. But how many are you really listening to what I'm saying? We hear sounds. But how many of these sounds do we really listen and we remember? So it's good to listen. You choose to listen as a leader. You speak with your members. Be an effective listener. And believe me, start practicing from home. And if you practice at home, you will bring it at work. And start practicing from work. And if you practice at work, you can take it at home. Because who we are in our personal lives is who we are in our business lives, and vice versa. We're not going to change. Okay? So the more we improve, either or, the more we improve, or either. Don't interrupt when they speak to you unless it is necessary. Don't jump into conclusions. If you interrupt, you're not going to listen to what the other people are saying. So listen, understand, and then speak. Listen requires focus, concentrate. You're paying attention to the story, how it is told. Pay attention to every single detail, the language, the voice, the tone, the body, the facial expressions. Summarize what they are telling you for a mutual understanding. So when somebody is giving you information, summarize it. So, Sister Mary, Dr. John, you're saying that the patient in room 9, Cornelia, for example, is having this, and this, and this, and that. Yes, and you did this, and this, and this, and that. The summary is going to provide a mutual agreement that the information that was communicated between the two parties was correct. I communicated the right information, you received the right information. And don't impose your solutions. You can ask if they are interested. If it's something that must be imposed, then yes, you're going to do it. Impose. If you're going to use, let's say, the autocratic leadership for a certain reason, yes, you need to impose. But if it's a time where there is no need to impose your solution, don't. Just ask them if they are interested. This is more or less how the communication takes place. We are sending the message. The message has to be encoded in the appropriate way, because depending on who the audience is, okay, we have to change our messages. I will give you a very simple example with my cousin. I have a cousin who is an oncologist. He lives in the States. He works in the States. And every time I have a conversation with him, I'm like, staring and, okay, now can you translate for me, please? he's using medical terms that sometimes for me, it's so difficult to understand. I need English language. I tell them, come on, my cousin, time to use English language. So if you're talking with another doctor, the encoding will include these medical terms. But if you're talking to a patient, the patient is not going to understand. So having in mind who you're talking to, you're going to encode the message in such a way so the understanding, the decoding of the message will be the appropriate message to the receiver. Okay? Influence without title. You don't need to have a title to influence other people or to lead. You don't need to be the chief medical officer. Sometimes influence is going to come from being reliable, thinking ahead, offering help, and teaching others. So you can be just managing a small group. You can be just the leader of a small group. You don't need to be the top of the top, and you are still able to influence some other people. And there are some leadership actions for the junior staff. Stay late when needed and arrive early. If you want, let's say, to go up in the hierarchy, offer to lead case reviews, start initiatives, hygiene audit, patient education posters. So if you want to show leadership abilities from an early stage of your career, you have to start acting like one, acting like a leader. Leadership is influence, nothing more, nothing less. So being able to influence. Leading in scarcity, which is the African reality, is something that's truly important. The African healthcare workers, they have to lead in contexts where there are no gloves, sometimes there is no light, no electricity, no backup staff. The patients, they can walk for 10 kilometers to reach a clinic. The staff can be unpaid for some months. Sometimes there are not even medical care facilities. So being a leader is even more difficult. Strong leaders need to prioritize the care. You focus on the urgent cases, so you need to prepare a priority list. You need to be innovative to the point where you need to get a Nobel in innovation. It's like you find solutions that maybe other doctors would never think. You use local solutions. You reuse the supplies where possible, safely. Build morale. If your subordinates are disappointed, the game is lost. Thank your team, even during chaos. Communicate clearly, say what's possible and what's not possible. Don't have your people wasting resources and time on what is not possible to be done just to prove yourself right. And the tip, lead with transparency. Don't give promises that you cannot keep, not to the doctors and not to the patients. Okay, so you need certain traits and certain skills. The skills is what you have. You bring them when you are born. Clever, conceptually skilled, creative, diplomatic and tactful, fluent in speaking, knowing people, knowledgeable about the group tasks, organized, persuasive, socially skilled. People who don't like people cannot really be effective in their job. You need to be a people's person. The traits, you can train yourself. So the traits are things that you can train to receive. It's skills that you can, let's say, have later on in your career. Like being adaptable to situations, alert to social environment and all the changes, being ambitious, want to achieve, you're assertive, cooperative, decisive, dependable, dominant, you are decisive, and you have the desire to influence other people. You are energetic, high energy, activity level, persistent, self-confident. You can take stress and you are willing to assume responsibility, because not everybody wants to take responsibility. So what are the management and leadership responsibilities of doctors? Just to summarize what we said. Responsibilities relating to employees. You need to deal with everything that has to do with employees. Planning, using, managing resources effectively and efficiently. You raise and acting on various concerns and problems, anything that is going to come to your attention. You help to develop and improve the services. And there might be some extra responsibilities that may only apply to some doctors, like doctors working in formal management roles. Not everybody are given management roles. Clinical, medical directors, doctors that are responsible for supervising and managing staff, doctors that are responsible for allocation of resources, doctors who are responsible for the quality of service. So these are some tasks that you might be asked to do when you will be given extra responsibilities besides the medical responsibilities as a doctor. You engage with colleagues to maintain and improve safety, quality of patient care. You raise concerns about patient safety. You see something that you don't like, you raise a concern about it. You are a member of the discussions and the decisions. You demonstrate effective teamwork and leadership. You promote a working environment free from discrimination. You, the leader, are going to start that, free from discrimination, from bullying, from harassment. You keep in mind that colleagues and patients come from diverse, from different backgrounds. And whether you like it or not, you need to contribute to teaching and training doctors. Not everybody likes to teach other people. Not everybody is born to be a teacher, but it can be part of your duties. So you're going to train other healthcare professionals, and you need to act as their role model. You might be responsible for organizing and managing clinics, clinic attendance, carrying out supervision, etc. So if you are the manager of clinics, prioritize clinical and non-clinical work. So you separate. This is clinical work, physician's work. This is non-clinical work. You have a list and you make priorities. You deal with complaints. All the complaints are going to come to you. Watch that movie, that series, if you have Netflix, New Amsterdam. It's not in Holland. It's New Amsterdam. It's a location in New York. There is a place in New York County in the States that is called New Amsterdam. Watch that and you will see exactly what I'm talking about. Delegate to others, both medical and non-medical members of the team, manage large-scale change, improvements, and innovations. So to summarize, and I'm finishing, in order to do all that, what do you need to know? You need to have competence in planning, resources, people, and performance. So you support the plans, you focus on what plays a vital role in the development and improvement of healthcare services. Gather feedback from patients, service users, colleagues. Colleagues will help you develop the plans. Do you know how much information you can get from your patients? Don't ignore the patients. The patients see everything. They know everything. Contribute there. They know everything that's happening inside your clinic. Just picture this. You are in your practice, you are in your office, and you are seeing patients. The patients are sitting outside in the waiting room. They can stay for 15 minutes, for half an hour, for 2 hours, depending on your time schedule. You know nothing. You know only the information that relates to the patient, what they have pain on, etc., etc. They are medical problems. The patient who sits outside in the waiting room, they see how your receptionist is handling people. They see the other patients. They hear conversations. They hear the phone calls from the reception. They hear the cleaners. They hear everybody who comes into their surgery, and they collect information. How are you going to collect this? Questionnaire. Have a questionnaire. Patient satisfaction, customer, patient service, patient healthcare satisfaction. If they are inpatients, ask them to complete one before they go. If they are regular patients, ask them to complete one after 3 or 4 visits of your time. Prepare a lovely questionnaire. You don't say they complain. You don't call it a kind of I want you to be my snitch. It's like, tell me what you had. No, that's gossip. You don't do it like this. There are other more polite ways of doing it. We care about your health. We care about the service that we provide to you. Your feedback is valuable for us. So give us feedback so we can improve the service for you. So you contribute their expertise to the planning process. Use your subordinates and appraise the options in terms of the benefits and the risks. What are the risks of taking one decision? What are the benefits? And you evaluate and you take what you need to take. You manage the resources. Accurately identify the type and the level of resources that is required to deliver the service, safe and effective. So you're sure that these resources are allocated accordingly to minimize the waste. You take action when the resources are not being used effectively and efficiently. Don't allow people to waste the resources. But to be able not to allow people, you need to know when people are wasting resources. And to know when people are wasting resources, it means that you need to plan such a good system of managing resources so you know exactly how the resources are being allocated and used. Manage people, you give guidance, direction, train them if it's needed, review the performance of the team members to ensure that they are doing what they are supposed to do, support the team members in their development of their roles and responsibilities, provide training when is needed, support others to provide good patient care and better services. Ask them to attend seminars, conferences, take them with you to training sessions, okay? So you try to improve their qualities. Manage their performance, you analyze information from a number of sources, appraisals, customer appraisals, the patient feedback from wherever you can collect information. You analyze this information and then you take action to improve the performance in case you realize there are some problems. You take responsibility for the difficult issues. You are going to find solutions with the contribution of your team members. So you need to build a learning experience that is going to lead you into the future plans. There are a lot of problems that might arise. Conflict. So you need to sort out this tension. There is miscommunication between a nurse and a doctor, and junior and a senior, a patient and a member staff. So you need to find a conflict resolution framework. You separate the facts from the feelings. Don't act with feelings. Take it from personal experience. Every time that I have used my feelings to take a decision, it was the wrong one. Wait until you use your logic. You've got feelings, you've got logic. When there is a war between the two, who wins? Feelings, always. I don't know why this is happening. It's the human nature. I don't know. But unless your feelings have settled, too much excitement, angry, happy. Don't take decisions when you're happy. Don't take decisions when you're sad. The decisions are going to be wrong. Wait until it's a normal situation. So separate the facts from the feelings. Speak privately, not in public. You have an issue with a doctor, you have an issue with a nurse, no matter how upset you are, speak them in privately and use neutral language. Don't say you're wrong. That is like you start a war, you're wrong. So if you tell me you're wrong and you point fingers, it's like you're making me defend myself. So we are getting into a conflict before it even started. Say, let's look at what happened and end with an agreement of the next step. Find a solution. What does the NHS proposes? Define clear and challenging goals. Build team commitment and positive emotional tone of climate. Staff and service users are valued. Encourage high staff involvement and engagement. Provide and operate meaningful design for organizations, sub-unit, individual jobs, and always have a very close cooperation with the human resource department. Management, the human resource department system that provides relevant staff development and rewards. So get them to have the HR department sending your employees for training. Ask them for budgets. Ask them to reward your employees. Listen, as we said, listen to your staff, not hear, listen and respond to their voice. Validate and engage with difficult or negative emotions evoked by the experience of delivering this care. Why leadership is important in the healthcare industry? It provides understanding the hospital goals. So understand the hospital goals with the collaboration among the team members to help achieve the organizational goals. Achievable vision and good communication. Help to recognize employees' potential. Unlock their potential. Poke them. Don't let them live into their world. Send them, as I said, to seminars. Unlock the potential. This is going to result in job contentment and less turnover. I love my job. I'm happy with my job. I'm not leaving. So they need proper education, which relates to their field. Promote sense of belonging, acceptance of diversity. Anybody who is different, any kind of difference, just accept it. provide mutual support, accept and understand their differences. This is going to allow creative thinking because they will all feel part of this team. And it's very important because it will provide the workers with the training to polish their skills and be even better. Enhance confidence and job satisfaction levels. So how employees view their job and their patient care, it should be part of them. I love being a doctor, not because of the money, because I love being a doctor. Staff will be more confident, organized, and well-trained. The team will be more self-sufficient. They say the less your children need you when they grow up, the more successful as a parent you are, because you have given them all the equipment that they need to be strong in their lives. So the better leader you are, the more self-sufficient your team members will be. They're not going to need you so much. So don't be disappointed when you see your team members one day handling everything very well by themselves. It's not because you failed, it's because you succeeded and you were a very good leader. Improve the skills and the abilities through the leadership training so you make use of their capabilities and to the full capacity. You help to accept the change within the healthcare sector. Not everybody accepts changes in the healthcare sector. It's easier to accept a change in the delivery of food, in managing a hotel, in developing a new product, than actually to accept a change in the healthcare sector. We have to understand the need for change, try out new improvements and advancements. This is only will bring the benefit. And to finish with something funny, I found this the 10 commandments of a doctor. Thou shalt not expect someone else to reduce your stress. Sorry, guys, it's your stress. It's your stress. Doctors have stress, unfortunately. So you need to find a way to handle it. Thou shalt not resist change. Change is going to happen. It's going to come. Thou shalt not try yourself in vain. Remember what is holy to thee. Honor thy limits. There is a limit for everything. Thou shalt not work alone. Nobody's alone. It's a team. It's a group work. Thou shalt not kill or take it out on others. Thou shalt not work harder. Thou shalt not work. Thou shalt work smarter. Seek to find joy and mastery in your work. Just master your job. Don't allow your job to master you. We will go crazy within the first year of our employment. And thou shalt continue to learn. Congratulations of what you're doing today. You're learning. You're doing exactly what it is said there. You are continuing to learn. So leadership is not about titles. It's about impact. Whether you are a nurse, medical officer, or an intern, your behavior is going to shape your team. Lead with humility, manage with respect, and serve with a purpose. It always seems impossible until it is done. This is what Nelson Mandela said. Nothing is impossible. And if the others can do it, then you can do it. Thank you very much.